When we think of painkillers, we often imagine them as our allies, the small pills that allow us to carry on with our day, finish our work, or sleep peacefully through the night. But here's the truth, that many don't want to face. These little tablets do not simply erase pain and disappear quietly from our bodies. They leave a footprint, and that footprint often lands on the very organs that keep us alive and functioning. The liver, the kidneys, and the stomach, silent workers inside us, carry the burden of these drugs long after the pain relief has worn off. And the danger lies in the fact that most of this damage happens invisibly without immediate warning signs until it's too late. Take acetaminophen, for example, one of the most widely used painkillers in the world. Most people assume it's safe because it's sold over the counter. But here's what isn't obvious. Your liver is the gatekeeper that has to process every milligram of it. The liver is a resilient organ designed to detoxify and filter what we consume. Yet, like any worker who is constantly overburdened, it eventually breaks down under relentless demand. Even a slight increase over the recommended daily dose can silently push the liver into overload, leading to what doctors call acute liver failure. The tragedy is that people often don't notice the warning signs until their health has already reached a critical stage. The kidneys, too, suffer quietly. NSAIDs like ibuprofen and naproxen, commonly used for headaches, back pain, and arthritis, interfere with blood flow to the kidneys. That interference seems small in the short term, but repeated over months and years, it weakens the kidney's filtering ability. Imagine a water filter clogged day after day, unable to clear impurities effectively. Slowly, waste builds up and the system falters. For seniors especially, whose kidney function is already naturally declining, this creates a dangerous storm. A pill that seems harmless for relief today may be pushing the body closer to kidney disease tomorrow. Then there's the stomach, perhaps the most direct victim of these drugs. NSAIDs don't just target pain, they also affect the stomach lining. They strip away the protective shield that guards us from our own stomach acid. The result, ulcers, bleeding, and discomfort that often show up as vague indigestion at first, but can escalate to life-threatening conditions. And here's the sobering reality. Many people mistake those early signs for something minor, never realizing that their own pain relief routine is fueling the problem. What makes this so philosophically troubling is that these drugs often work in disguise. They provide quick comfort, a temporary escape, and that's what makes them so seductive. Human beings are wired to seek relief from suffering. It's natural. But the irony is that in our desire to escape discomfort, we sometimes invite an even deeper, hidden harm. There's a lesson here that stretches beyond medicine. What appears to ease our burdens on the surface can sometimes create heavier chains beneath it. This doesn't mean we must fear every pill or avoid medical treatment. It means we must become conscious of the choices we make with our health. Painkillers have their place, especially when used under medical guidance. The problem arises when they become a reflex, the automatic solution we reach for at the first sign of discomfort, without asking whether our body is paying a price we cannot yet see. So I urge you to start thinking differently about that small bottle in your medicine cabinet. It isn't just filled with relief, it's filled with responsibility. Each pill asks a question: is this truly necessary? Or am I ignoring other ways to care for my body? Could hydration, movement, posture correction, or even stress reduction address the root of my discomfort instead? If the body is crying out in pain, perhaps it is not simply demanding silence through a pill, but calling us to listen more deeply to discover what is really wrong. The silent strain on our liver, kidneys, and stomach reminds us of a bigger truth about health. Nothing in life is free. Every action has a cost. Even comfort comes with a bill attached. The question is whether we are willing to pay it with our long-term health. And here's the reflection I leave you with. Relief that comes quickly but harms quietly is not true healing. It is only borrowed time. The wiser path is to balance short-term relief with long-term respect for the body, so that the very organs working tirelessly to keep us alive can continue to serve us with strength. The next time you hold a painkiller in your hand, don't just see a pill, see the invisible burden it places on your body. Use it wisely, sparingly, and always with awareness. Because the greatest form of pain relief is not found in silencing your body, but in learning to listen to it. And when you choose that path, you are not just avoiding harm, you are honoring the very life force that sustains you. When we think about painkillers, most of us only focus on their immediate effect. The headache fades, the joint feels less stiff, the back-itch eases enough for us to get through the day. What rarely crosses our mind is how these drugs affect the silent network of systems inside us. our heart, our brain, our circulatory system. Painkillers don't just act locally, they ripple throughout the body. And sometimes that ripple can become a storm. Let's take the heart, for example. NSAIDs like ibuprofen and naproxen are among the most commonly used painkillers, yet decades of research now show they can increase the risk of heart attack and stroke. They do this by affecting the balance of chemicals that regulate blood clotting and blood vessel function. They also raise blood pressure, which quietly adds more strain to the cardiovascular system. For someone who already has heart disease, hypertension, or even a family history of cardiovascular issues, regular use of these drugs is like stacking more weight on a bridge that is already showing cracks. Eventually, something gives. And here's the uncomfortable reality. Many people never connect the dots between their pain relief and a sudden cardiac event because the link is subtle, cumulative, and hidden until it surfaces as a crisis. Now, consider the brain. Opioids, powerful painkillers often prescribed after surgery or for chronic conditions, don't just dull physical pain. They also alter the brain's reward system, releasing floods of dopamine that create a sense of euphoria. In the short term, this feels like relief. But the brain, always striving for balance, adapts by reducing its natural production of these feel-good chemicals. The result is tolerance. You need more of the drug to feel the same effect. And dependence, where the brain begins to feel it cannot function without the drug. What began as a tool for managing pain becomes a trap. And the psychological depth of this cannot be overstated. When the brain's chemistry is altered, the very essence of who we are, our mood, our motivation, our resilience, becomes entangled with a pill. This leads us to a larger philosophical point. We live in a culture that often prioritizes quick fixes over long-term solutions. Painkillers fit perfectly into this mindset: instant relief, minimal effort. But what they quietly do is train both the body and mind to expect external rescue instead of developing internal resilience. The heart becomes more vulnerable, the brain more dependent, and our relationship with discomfort more fragile. In a way, our over-reliance on painkillers mirrors a broader societal tendency to avoid facing the root of problems, preferring temporary silence over deeper healing. Another hidden effect lies in circulation and clotting. Some painkillers increase the risk of blood clots forming in veins and arteries. A clot in the wrong place can mean a stroke, a pulmonary embolism, or a heart attack. These events often appear sudden and random, but beneath the surface, the stage was being set over months or years of regular drug use. Think about how unsettling that is. A decision made in a moment of discomfort, reaching for a pill, can echo into life-threatening consequences far in the future. Even in the realm of mental health, the side effects of painkillers are not discussed enough. Long-term use of opioids is strongly linked to depression, anxiety, and even changes in personality. The drug that once promised freedom from pain can, over time, create a prison of emotional instability. And it doesn't just affect the person taking the medication, it ripples outward, touching families, workplaces, and communities. A father who once had energy and focus may now feel dulled and detached. A mother who sought relief for chronic pain may find herself trapped in cycles of dependency and emotional strain. The cost of hidden side effects is never just individual, it is collective. What we need to ask ourselves, then, is not simply whether painkillers are effective in the short term. The real question is, what are they teaching our bodies and our minds over the long haul? Are they helping us move toward resilience, strength, and true healing? Or are they subtly reshaping us into more fragile beings, more dependent on external solutions, and less able to adapt naturally to the challenges of life? The answer is not to demonize these medications. They have their place, and when used wisely and sparingly, they can be life-changing. But wisdom requires awareness, and awareness requires that we lift the veil on these hidden effects. Painkillers do not only silence pain, they influence our heart, our brain, our circulation, and our emotions. If we are going to use them, we must do so with respect, caution, and the knowledge that every choice we make has a ripple effect in our bodies. And so, I leave you with this thought: every pill is a conversation between you and your body. If you listen carefully, you will hear not only relief, but also warning. The heart may whisper its strain, the brain may hint at its growing dependence, and the spirit may feel the subtle loss of resilience. The question is, will you listen before the whisper becomes a scream? Relief is important, but protecting the essence of who you are, your mind, your heart, your vitality, is far more valuable. Choose wisely, because the truest healing comes not from silencing the body, but from strengthening it. When we talk about painkillers, we often frame the conversation around the body, what they do to the heart, the stomach, or the kidneys. But what often slips beneath the radar And perhaps what is even more insidious is what these medications do to the mind. Dependency is not just a chemical reaction, it is a psychological reprogramming. It alters the way we relate to ourselves, to our pain, and to the world around us. And if we don't recognize this early, we risk surrendering not just our health, but also our autonomy. Think about how pain is supposed to function. It's the body's alarm system. It tells us when something is wrong, when we've pushed too hard, or when we need to rest. But when we silence that alarm too often, we begin to detach from the messages our body is trying to send. Over time, our relationship with discomfort becomes distorted. Instead of seeing pain as information, we begin to see it as an enemy that must be eradicated at all costs. That shift in mindset is the breeding ground for dependency. Because once we decide that pain itself is intolerable, we will always reach for the fastest tool to eliminate it. And that tool, for many, is a pill. Now, let's be clear, dependency doesn't always look like what Hollywood portrays, someone desperate, out of control, unable to function. More often, it is subtle. It's the person who says, I can't get through my day without my medication. It's the grandmother who won't travel without an extra bottle in her purse, or the middle-aged worker who feels anxious if there's not a refill lined up at the pharmacy. This is dependency dressed in respectability. It doesn't look chaotic, but it erodes freedom all the same. The mind begins to tether its sense of safety and stability to the presence of that pill. And here's the deeper philosophical issue. When we rely on external substances to manage internal states, we weaken our belief in our own resilience. The mind slowly learns that it cannot cope without help, that it cannot withstand discomfort on its own. And that lesson seeps into other areas of life. It's no longer just about pain. Stress feels unmanageable. Sadness feels unbearable. Frustration feels intolerable. The psychological muscle that allows us to endure, adapt, and overcome begins to atrophy. Dependency doesn't just change brain chemistry, it reshapes identity. Science backs this up. With repeated exposure, opioids and even certain non-opioid painkillers alter the brain's reward pathways. Dopamine, the chemical messenger that tells us when something is pleasurable, becomes hijacked. Natural rewards like exercise, laughter, or meaningful connection no longer register with the same intensity. Instead, the brain begins to prioritize the drug, and with that comes tolerance. The dose that once worked no longer does, so the mind starts pushing for more. This is where the slippery slope becomes steep, where dependency shifts toward addiction. And at that point, the psychological grip is often tighter than the physical one. But let's step back for a moment and ask, why do so many fall into this cycle? It's not just about chemistry, it's about culture. We live in a society that glorifies comfort and convenience. We are conditioned to believe that suffering in any form is unacceptable. We medicate sadness, medicate stress, medicate even the normal aches of aging. And in doing so, we create a psychology of fragility. We rob ourselves of the opportunity to face hardship, to build endurance, to grow stronger through challenge. Painkillers in this light are not just medical tools, they are cultural symbols of our collective intolerance for discomfort. This is not to say that pain should be ignored or endured without support. Pain can be debilitating, and painkillers can be a gift when used wisely. But wisdom lies in balance. Dependency begins when we forget that pills are a bridge, not a home. They are meant to help us cross a difficult season, not to become the foundation of our daily existence. And here's the empowering truth. The human mind is capable of far more resilience than we give it credit for. Studies on mindfulness, physical therapy, and even community support show that people can dramatically reduce their reliance on painkillers when they learn to reinterpret their relationship with pain. Instead of seeing it as an unbearable force, they begin to see it as a signal they can respond to, manage, and even grow through. This shift restores agency. It tells the mind, I am not powerless. I am not dependent. I have tools within me. So I ask you to reflect, what would it mean for you to reclaim that inner resilience? To view pain not as a foe to be silenced, but as a teacher pointing you toward deeper care, deeper awareness, and deeper strength. Dependency on painkillers may offer short-term relief, but it steals long-term freedom. The most valuable gift you can give yourself is not another refill. It is the confidence that you can face life's discomforts with courage, clarity, and control. And let that be the takeaway. True strength is not the absence of pain, but the ability to rise above it without surrendering who you are. When we come to the question of long-term health consequences, we're really looking at the bigger picture, the part of the story that often gets ignored in the rush to silence pain quickly. Painkillers, when used occasionally and carefully, can serve a purpose, but when they become a daily habit, When they become a reflexive response rather than a thoughtful choice, they start to carve deep grooves in the body that are not easy to repair. This is where the conversation shifts from short-term relief to long-term risk. And it's a conversation that too many people avoid until it's too late. The human body is astonishingly adaptive. It can take insults, stresses, even toxic exposures, and still find ways to heal. But what we often forget is that resilience has limits. Every pill we swallow has ripple effects, some visible, some invisible, that accumulate over years. Take the stomach, for example. Non-steroidal anti-inflammatory drugs and NSAIDs, which so many reach for daily, gradually wear down the protective lining of the stomach and intestines. At first, it might just feel like heartburn or indigestion. But left unchecked, it can lead to ulcers, bleeding, even life-threatening complications. It's not an immediate catastrophe. It's the slow erosion of a system that was designed to protect you. Or consider the kidneys. These silent workhorses filter the bloodstream 24 hours a day, extracting waste and maintaining balance. They don't cry out in pain until damage is advanced. Painkillers, particularly when used chronically, place immense strain on them. Over time, this can progress to kidney disease, a condition that not only diminishes quality of life, but often goes unnoticed until it is severe. And here's the sobering truth. Once kidney function is lost, it rarely comes back. Dialysis, transplant, and dependence on machines become the reality for many who never realized that their daily pill for back pain was quietly draining their lifeline. The heart, too, is not immune. Some classes of painkillers raise blood pressure, increase the risk of heart attack, and interfere with circulation. For a senior already walking the tightrope of cardiovascular health, this is not a small risk. And the tragedy is that many only discover these dangers when they find themselves in the hospital after a major cardiac event, looking back and wondering if the pills that gave them comfort might also have been pushing them toward crisis. But perhaps the greatest consequence of long-term reliance on painkillers is not just physical, it is philosophical. It is the slow conditioning of the mind and body to seek an external answer for every internal struggle. We lose touch with the deeper rhythms of healing that the body is capable of when supported properly. We forget that food can be medicine, that movement can be medicine, that stillness, sleep, breath, and connection can all play profound roles in reducing pain and restoring balance. The more we reach for the quick fix, the more we narrow our field of vision until all we see is a pill bottle. And in that narrowing, we give away our power. The alternatives are not glamorous. They require patience, commitment, and sometimes discomfort. Physical therapy demands discipline. Meditation asks us to sit with sensations we would rather avoid. Anti-inflammatory diets mean rethinking the foods we've leaned on for comfort. But these alternatives have something painkillers never will. They strengthen rather than weaken. They build capacity rather than dependency. They remind the body and mind of their own resilience rather than outsourcing it to a chemical. It's worth asking ourselves a difficult but honest question. What do we really want for our later years? Is it a fragile comfort propped up by daily medication? Or is it a robust vitality rooted in choices that sustain rather than drain us? Painkillers may offer ease in the moment, but they often rob us of freedom in the long run. And the irony is that what feels like control, having the pill within reach, may actually be the very thing that chains us to future illness. So the challenge is not simply medical, it's moral. It's about deciding whether we will live reactively or proactively, whether we will accept the seduction of the quick fix or do the harder work of building a life that doesn't depend on it. Pain is a universal human experience, but how we respond to it defines not only our health, but our character. I want you to think about this. Every pill you take is a choice. It's not just chemistry, it's philosophy in action. Are you choosing a short path that leads to dependency and decline, or a longer path that requires effort but leads to strength, independence, and longevity? That choice is not made once, it's made daily. And every small decision accumulates into the story of your health. So, let us leave with this truth. Your body is designed for resilience, but it requires your partnership. Painkillers may dull discomfort, but safer alternatives awaken the body's natural capacity to heal. The decision is yours. Silence the symptoms for today, or nurture the strength that carries you into tomorrow.